Hi, everyone, and welcome to our training on effective communication and maybe some thoughts around how we bring the right attitude to our training. So, in today's module, we're going to address how we might appreciate how inclusion benefits us all. We'll define what inclusive language means and talk a little bit about how we might use a person-centered approach. But before I get in too deep, I want to welcome and hear a little bit from Terry Thorson, who's going to share some of her lived experiences and answer some of these key questions to get us started in a good way. Over to you, Terry.
Hello, everyone. My name is Terry Thorson, and I am the manager of peer coaching and outreach with Spinal Cord Injury BC. I'm also a person with lived experience of spinal cord injury. I acquired my spinal cord injury in 1996 when I was traveling in Australia, and I was the passenger in a motor vehicle crash. I sustained a C6 complete injury, which means that I don't have any hand function, as you can probably see. And I also don't have any mobility or sensation from about chest level down. But that's not really how I define who I am. I'm also a Paralympian in wheelchair racing. I was on the provincial wheelchair rugby team for a number of years and then became a coach after I retired from sport altogether. I'm a mother, I'm a partner, and I live here in beautiful British Columbia. So, how did I learn how to be an effective and inclusive communicator? Well, I can tell you that I'm still learning, and I'm sure we all will be. Language is changing all the time, and it's changing fast. So, there's always something new and always something to learn. I have taken courses on being inclusive of other disabilities. I am particularly very comfortable within the spinal cord injury community, but am looking at other ways on how to be more inclusive of other disabilities into our programming, for example. One of the a great place to start is assumptions and biases. Sometimes we don't actually realize what unconscious biases we might be bringing into our interactions with people in general. So I really recommend that being a great place to start. And one of the ones that I'm working on right now is gender neutral language. But there is a lot out there to research and investigate. I think you can just look at your community that you see and choose something and research on that, or maybe something that you're interested in. I do make a lot of mistakes because I am still learning. One of the things I try to do, especially when I'm making a mistake in front of someone, is to admit that I made that mistake, apologize. And then to myself, I really am determined to do better next time. But I do find that once I have started recognizing these mistakes, that it has made me become more aware. And so hopefully I'll eventually stop using certain language that may be offensive to other people. Another way is really just to ask people. So learn their preferences. And then you can be also transparent in where you're at in your learning journey. Maybe you're just starting, maybe you're continuing. But again, it's going to be a process for everybody, and we're all going to be in different places. So I think just being clear and open about that is really great. How did perceptions and communications change after my injury? Well, I actually really felt that my identity was ripped away from me after I had my injury. I felt like I became my disability. People described me as being a quad, or that I was a quad, or a wheelchair person. So actually, my sexuality was really taken away. So now being recognized as a woman is really important to me. But I think identity extends beyond like what we see in front of us. And so how do we define roles and identities is kind of an interesting question to ask ourselves. So if we look at characteristics rather than roles or titles, I think we can see more on what we have in common rather than what separates us. So, for example, like some of my characteristics that I think, I would hope, my friends and colleagues might say about me is that I'm determined, or I'm empathetic, or I'm a leader. So, I think if we can start recognizing these characteristics in ourselves, we can also start recognizing them in others. And then my hope is that we can start treating each other like we're just human and we don't have to put labels on things. Ultimately, my dream would be that we never have to use the word disability. It doesn't even exist because everything is just accessible and inclusive for everyone.
Thanks, Terry, for sharing a little bit of your story. So I'm excited to continue to deeper into this topic. So we're going to start here with talking about our appreciation for how inclusion really can benefit all of us. So I want you to start by thinking of a time when maybe you were running your own exercise program or you were a part of a group fitness class and you had to make some changes. Maybe it was because you had a temporary injury, maybe last night's sleep didn't go so well, or there's some stressful things going on in your life right now. We all need changes that allow us to tailor our needs, and sometimes just need a little bit of change to how we do exercise and movement. So that's all to say is that while we are talking about working with individuals with disability in an exercise setting, ultimately this is something that we all benefit from. We all benefit from these opportunities for tailoring and inclusion. So in this module, we're going to talk a little bit more deeply around what is disability and inclusive fitness. We'll talk about the benefits of exercise for individuals with physical disability and functional limitations, and also highlight how these benefits of inclusion are really something that we all stand to benefit from. Now, I want to make a note that as a bit of a disclaimer, our focus in this training is on physical disability. So we're talking about limitations to an individual's physical functioning, and we might be talking about those limitations that are temporary or permanent. Now, there are certainly overlapping principles when we talk about, for example, individuals with sensory or intellectual disabilities, but we really are focused on physical disability. And so if you're interested in working with individuals with sensory and intellectual disabilities, I highly recommend seeking out more resources, and we'll include some other resources for learning more about disabilities beyond our training on the website. So let's start with a definition, and that's all to say is that there isn't really one way to define disability. But we do know is that disability is a part of being human. Just over a quarter of Canadians 15 years and older identify as having a disability that limits their daily activities. About 40% of us have a person in our lives that has a disability. So someone in our immediate circle of family and friends, we know someone with a disability. And while we might not have this exact definition, there's one definition of disability, I think that's a really important take home, because just because you've met one person with a disability, well, that just means that you've met one person with a disability. And I think that's where we kind of find that common ground with humanity, is that we all have unique experiences that come to light for us. So painting a broad brush amongst a group doesn't really serve us all that well. But we'll get into some of those pieces around how we have a conversation to understand each individual situation. So I like to use the World Health Organization in defining disability. It's this way of looking at it as an umbrella term where we not only address how disability can affect our body function and structure. So we might think about things like our pain or ability to move, but to think about how that impacts our activities on the day to day. So, for example, things like our exercise and physical activity, or maybe our activities of daily living, doing our chores, doing the laundry, etc. But also more broadly, our participation in life situations. So whether that be our work, how we engage socially, and that all of these factors are impacted not only by personal considerations, but also factors in our environment. And so that's kind of tying it all together, is that it's not just about the cause of disability when we talk about disability, but really the focus that it has on an individual's life. And when we view it this way, it means that disability can be viewed as a universal human experience and not just something that is experienced by a minority of the population. But as we saw in those previous statistics, really disability is quite prevalent um, across the population. Now, I won't spend too much time here because I know that if you're watching this recording, it probably means that you drink the Kool-Aid that exercise is beneficial. So we do know this, and we have a wealth of evidence to support the benefits of exercise. And, when we look at short-term health benefits, we're oftentimes thinking, we might see improvements in how strong we are, our fitness and being able to keep going for a long period of time, our ability to manage our own self-care. I'm sure many of us have experienced the benefits of exercise for mental health, but I also really like to think about the benefits of exercise for what it means in developing community and socializing. And then, in terms of our long-term health benefits, certainly we have an abundance of evidence that supports the impact of exercise on decreasing risk for chronic disease, like cardiovascular disease, diabetes, stroke. Um, allows us to maintain our independence and maybe even improve our quality of life. So when we think about the benefits of exercise as this really broad picture, it sort of reminds us that yes, more exercise and more physical activity is typically better, but something is better than nothing, and even small amounts can have meaningful outcomes, and those meaningful outcomes are going to be unique to each individual. Now, it's not all rainbows and butterflies. Physical activity can be hard. And I really appreciate this quote from one of our study participants who lives with rheumatoid arthritis and shared, I think people judge because they can't see it, and that's hard. And I also think sometimes people can think that you're just being lazy when you're tired. And that's unfortunate because it's not. It's like a different type of tired. There's nothing I can do about it. I can sleep 12 hours and still be exhausted, and that's how it is. I think it's just people are quick to judge without realizing what other people are dealing with. So this is Ria's experience, a pseudonym being used here, with exercise and her experience coming back to a gym after her diagnosis, right? And why I like to share this quote is we can see here that the barriers here are layered. There's the barrier fatigue itself, right? Looking at that individual barrier. But there are also barriers related to the people surrounding her, those impressions, the judgment, right? And so when we think about promoting physical activity, it's also important that we recognize that there are over 200 barriers to being physically active for individuals with physical disability. So it's really no surprise that individuals with disability are 16 to 62% less likely to meet physical activity guidelines of 150 minutes of moderate to vigorous physical activity a week. And we know the health implications of that. And this was a really important statement that was published in The Lancet, which is one of the world's leading medical journals, that made the statement that our healthcare services are failing the 1.5 billion individuals with disabilities worldwide. So the call to action here is, how do we move the needle? How do we help increase physical activity levels among individuals with disability? And I think that's a really exciting space for us, right? We can take a look at how we make our fitness spaces more inclusive so that we create these opportunities for movement that optimize participation for all. Now, when we're talking about inclusive fitness, I also like to introduce the concept of universal design, where we can create our spaces, products, services, and experiences that are usable and accessible for everyone. And while we might be talking about physical disability today, I think when we create our spaces and have these be universally designed, it also has implications for perhaps variations in the ages that might be using our spaces, our sizes, our abilities, what have you. So we are going to get into a little bit more around universal design in our inclusive and accessible environments module. But the reason why I bring this up is I just want to reiterate that viewing fitness in a way that benefits everyone is absolutely paramount to doing this work well. And it really sort of extends beyond this idea of like, oh, it only affects a small minority of individuals, but really we all stand to benefit from inclusion. So we're now going to shift gears here and talk a little bit about how we define inclusive language. And I'm going to turn it over to Terry again to talk about how we might use appropriate terminology and appreciate that there are always going to be individual preferences, and also how we can adopt disability inclusive language, give concrete examples of what that looks like, and value just how important it is that we're using inclusive language. Back over to you, Terry.
Awesome. Thanks, Jasmine. Okay. First, I want to start by just saying that language is a very powerful tool. It can reinforce stereotypes and discrimination, or it can foster inclusion and belonging. Language is also nuanced and very personal. And as you probably know, some phrases that we may have used 10 years ago might not be appropriate now. And of course, it's changing all the time, and we're always learning what the new phrase is today. So for people with disabilities, I'll start with like identity first and person first language. So some like identity first language, and that would an example would be I'm a deaf person. And others like person first language. An example of that would be I'm a trans woman with a disability. Asking each individual is the best way to discover their preference. Personally, for me, I prefer being recognized first as a woman. And the reason for that is because after I had my injury, I actually felt like my sexuality or gender was stripped away from me, and I became a disability. So I really advocate for being a woman first. So language can hold great personal significance for people. Every person with a disability has their own individual preference on how they identify themselves, and it's really important to respect that preference. I will say, though, when you are speaking directly with someone with a disability, you don't actually need to know whether they prefer identity first or person first language. It's really only important if you're speaking about them. Really, we all just like to be called by our name. That's about it. Focus on the can, not the can't. So words like, or phrases like wheelchair bound. Well, we're not tied to our wheelchairs. We do use a wheelchair and we can get out of them. So much to most people's confusion, I guess. We don't sleep in them. People with disabilities also have to advocate for themselves every day. And it really, truly is exhausting. We need more allies out there who can help advocate for accessibility. I also just want to say that using the word challenged or handicapped can make a person feel lesser than someone else, which is why we use terms like accessible parking spot or an accessible bathroom. And actually, I don't know whether this is a true story or not, but someone had told me that the word handicap comes from when soldiers came back from the First World War. They had to beg on the street, and so they had the cap in hand. So I've never used that word anymore and obviously have negative connotations to it. All right, so avoiding words. So especially avoid words that convey pity, such as suffering from, affected with, or victim. Best to avoid euphemisms for disability, so such as differently abled. Some individuals actually may be comfortable or even prefer this type of language, but the general consensus within the disability community is to avoid its usage altogether, as it can be viewed as condescending or othering. Normalizing disability is the goal. Disability should not be a bad word. It's part of human diversity. So other disability-related euphemisms include differently abled, as I mentioned, physically challenged, handy-capable, special needs is one that's really used quite often, or special abilities. Okay, one of the phrases that I hear, oh my gosh, so many times, you're so inspiring. always hear it. If the person is doing something or has accomplished something truly inspiring, then of course you can certainly pass along the compliment. I feel like I'm very inspiring because I went to the Paralympics. I mean, who gets the opportunity to do that? However, if they're simply existing in the world as a disabled person or doing an everyday task like grocery shopping, it's really not appropriate. Oh, buying toilet paper is not an inspiring thing, let me tell you. If people fixate on how challenged they think disabled people are, the emphasis shifts to their obstacles rather than their achievements. Collective nouns like the blind or the disabled creates this us and them language. And we are all each unique, individual, and human. And then patient, we only use patient if we're actually treating someone in a hospital-like setting. So sometimes people will use client or consumer if you're purchasing something. And most people with a disability aren't sick unless we're actually sick, like with a cold or something. But a lot of us aren't, permanently sick. Expressions, I'm just going to talk a little bit about expressions too, like let's go for a walk or fine. Most people with disability will unlikely take offense. Someone who uses a wheelchair may even say that they're going for a walk. I often say, like, let's go for a walk. Maybe they'll choose to say, let's go for a wheel. Don't feel uncomfortable if you are walking or inviting them for a walk. But, there's some phrases that are like, what are you blind? What are you deaf? Or other phrases like turn a blind eye, that's crazy. Or even despite their disability, they can do this, should really be avoided. What happened to you? I get asked this question a lot. Like, what happened to you? Really not an appropriate question to ask either. I mean, nothing may have happened to the person, actually. They may have been born with their disability, or something traumatic may have happened to the person to cause their disability. And then this may actually remind them of the traumatic event. So it's just really personal. The person may not want to talk about it unless you need to know in order to treat them. It's best not to ask any questions about their disability, kind of the how or the what. If you ever want to ask a personal question, just ask yourself first, why do I need to know? And how will this help me by knowing? All right. Always talk directly to the person with a disability, even if they are with someone. So that could be a support person, maybe it's an interpreter or a friend. Even if you cannot understand them, or maybe they use sign language or are using an interpreter, it's really important to speak directly to the person with a disability and look them in the eye. And if you need to pull up a chair to do that, that's totally great. We never want to make any assumptions about a person or their ability. So one of the questions that I always get is, do you need help? So just don't assume someone needs help simply because they have a disability. If someone appears to be struggling with something or likely to need help, it's of course okay to ask if they need help, just like you would, I guess, anyone else. But maybe a different way of saying it is, can I help? It seems a bit less presumptuous that the person needs help, and instead is just a simple offer. And the person may decide that they'd appreciate the help even if they don't need it.
So now we'll transition to our last section in this module. We'll talk about how we can use a person-centered approach to our communication. And to do that, I'm going to welcome Grace Scouten, who's going to talk to us about practicing empathy and respect when communicating with clients. Grace is a graduate of the University of British Columbia kinesiology program, but she also brings a wealth of experience in working with individuals with disability, both in her own family as well as in her employment and volunteer experiences. So welcome, Grace.
Awesome. Thanks so much, Jasmine. So we're going to talk a little bit about having an open mind. This is such an important part of practicing respect and empathy. And an important part here is asking, how can I help? So being willing to be available and help people. And when I'm asking if people want help, I like to use the language, how can I help? Rather than, let me know if you need help. Just because I find, at least for myself, when someone asks, hey, let me know if you need help, It puts the burden of asking for help back on me, which is something I'm pretty bad at. I don't like, asking for help. But if someone's saying, I'm here, I'm available, let me know what I can do, it makes it a lot easier to reach out. And at the end of the day, someone can still say, no, I'm good. Of course, this is going to vary person to person. It's so individual. It varies by setting, context. I've had clients say, Grace, I know you're available. You don't have to keep asking or keep offering. I'll let you know when I need help. And that's our relationship. I'm not going to offer help. I know that they'll just reach out when they need it. So, of course, ask your client, respect your client's preferences. Another thing is to value and learn from diverse expertise. So, expertise can come in lived experience. So, maybe you live with a disability or learned. So, I have a kinesiology degree. Maybe you've done courses and exercise programming. And both types of expertise are so important, so valuable, and bring so much to the table. So, it's important that we value and respect everyone's. Another thing is learning from the expertise, recognizing that not only is their expertise valuable, but it can actually teach you something. So being willing to learn from them, maybe change things that you believe or think, kind of do a little bit of an update there. There's so much growth that can happen when we open up our hearts and our minds to being willing to learn from people. So, something that we can bring in our learned experience as fitness professionals is something called motivational interviewing, or MI. So, MI was designed to help with ambivalence, and it's a directive, client-centered approach to behavior change, which is why we're talking about it today, because it's client-centered, and that's what we're all about. So, motivational interviewing helps us to have both a mindset and a heart set. So, this is CAPE. It's a little acronym that we can use to help us remember the principles or the spirit of MI. So, in CAPE, the C stands for compassion, caring about what's important for someone else and wanting to help. A is for acceptance, respecting another person, and their right to change, but also their right not to change. We all love exercise. We probably all here believe in its benefits. Sometimes people just don't want to, and we do have to respect that as well. P is for partnership, working together with another person and recognizing them as equal. It's a partnership. Both forms of expertise are just as important. Both bring things to the table. The E is for evocation, bringing out another's ideas, strengths, or knowledge. Because we bring such diverse expertise to a table, we can use these to help other people grow. Ask probing questions. Have you ever thought about it like this? Hey, have you ever tried this? We're able to, work together to learn more, to grow more, because what we bring is so different, but also complementary. So I invite you to take a moment to think about what each of these mean to you. Maybe it's a time that you demonstrated compassion, or what does acceptance mean to you? How are you going to, do more partnership in your work? And with that, I will pass it back to Jasmine.
Thanks, Grace. So now we're going to move on to talking about universal design and how it applies to our effective communication strategies, as well as consider the different modalities in which we can relay our information based on an individual's need. So universal design for learning is based on three key principles: engagement, representation, and action and expression. And if we link these to the exercise context, engagement is where we have different ways in which we can encourage participation. So that might be things like giving choices to clients and the types of exercises they do, providing a range of equipment that you might use for a given movement. Our action and expression, the third one there down at the bottom, is how we give different options for demonstrating competency. So sometimes the goal is, can we lift heavier? Can we move for longer? But maybe it's other goals, like, are we feeling more confident? Did we get the technique right? So giving different options in which we express the way that we are competent. Now, where I'm going to spend most of our time here, though, is on representation and the different ways in which we can offer information in multiple formats. So as a starting place, when we're communicating, I oftentimes will like to ask the question, what can I do to best communicate with you? And we don't always have that opportunity to ask the question. So as general sweeping principles, if we're thinking about that inclusive communication that is universally designed, a couple things can help be that guiding light. One is keep it simple. So use instructions that are clear and concise, to the point, and use language that we can all understand. Be flexible. So give different formats, different ways, can you show me, tell me, or move me? And some examples here are, for example, in circuit classes, you might have handouts or pictures at each station for what the movement looks like. Many of us will demonstrate an exercise, so show what it's like to do the movement. And with certain individuals, it might be actually necessary to physically guide for technique. Of course, we ask for permission first, but I know, for example, some of my clients with stroke in the past, giving those visual and verbal instructions aren't enough. We actually have to take, limbs and move them in the spaces for that to make sense. Depends on the individual, of course. Communication boards, there are lots of different ways in which we can do this. It could be the old-fashioned way with our whiteboards and chalkboards, but we've gotten a lot fancier now too, or some spaces are equipped with screens where we can have videos or pictures that demonstrate or depict the workout. Some other strategies that we've used are to email those instructions in advance. That allows the individual to be able to get a bit of a sense of what to expect. But if they, for example, use something like a screen reader to help them understand instructions, then that's also an option too, to deliver those in those formats. And then making sure we've got this mutual understanding. So at the end of a session or at periodic checkpoints, getting some reflections, like how are things going, right? And at the end of the session, I love to use a bit of a teach back of, so what did you take away from this? And that also opens up an opportunity to maybe have some discussion and further dig into certain areas of technique if we need a little bit more information. Now, delivery modalities, I think post-COVID, we've really opened the doors for the many ways in which we can interface with one another. There's, of course, in person. And there's something to certainly be said for developing community connections when we do our exercise and our movement in person. That being said, I've also seen a lot of really great success stories in delivering live group exercise sessions online. And that can help to decrease barriers like transportation, right? Maybe cost, and just kind of convenience, right? And then there's also recorded, where certain times of day don't necessarily work for everyone. For some individuals, that morning routine might take much longer. So making an 8 a.m. class might not be as feasible. So in thinking about the different ways in which we deliver, we really do have to consider the balance between how do we develop community? Are we thinking about accessibility? Can we make it flexible? And also, what sort of resources do we have available for us? So the last section that I'll talk about here are strategies for meaningfully engaging clients in the exercise prescription design. And it's really about asking the right questions. So when we're asking the right questions, I'm often thinking about the concept of shared decision-making. This is a way of communicating that really takes a focus on your patient or your client's values and preferences. It's a strategy, but also it's an attitude and a philosophy where we're acknowledging that we both have expertise to bring to the table. And I love this quote here, where patients or clients or community members are viewed as experts on their own health, values and lifestyle, and clinicians as experts about treatment options, potential limitations, and benefits. So the client themselves, they know their body best. They know their experiences themselves best. And so they've got a wealth of information that they're coming with, perhaps around their disease or the disability in their day-to-day. And then for us as exercise professionals, we're also bringing in the expertise on how to do exercise safely. So it's really sort of this meeting of the minds and respecting that we both have expertise to bring. And I always remember one of our collaborators, Alison Hoon, she said to me at one point, you've got a PhD in exercise science, but I have a PhD in lived experience. So we both have something to bring to the table. So how do we start to have these conversations? Grace talked about the spirit of motivational interviewing, and I'm going to get into some of the fundamental processes or the strategies of motivational interviewing. And one of those strategies is, they love acronyms, is OARS. So ORS stands for our open-ended questions, affirmations, reflections, and summaries. So when we ask open-ended questions, they leave the table open for digging deeper and having more of a conversation rather than the do you ... that can just be answered with a yes or a no. When we start questions with something like a how, what, or tell me more about, etc., then we get into something a little bit deeper. Our affirmations is what I'm envisioning, you nodding your head towards some of these points that we're making, right? Sometimes they're those verbal affirmations, right? Acknowledgements that, we're on the same wavelength, or acknowledging that we've done something headed in the right direction. So those sort of things that kind of add some positivity into our conversation. Our reflections and summaries are very much related. So reflections are ways in which we might paraphrase or reflect back what our client has shared with us. So what I'm hearing is, or, it sounds like ... So the point here is not to come up with your own ideas of what your client is saying, but trying to rephrase back to them what you're hearing. What that does is it demonstrates that we're actively listening, but also opens up the floor for the client to really drive the conversation, where if what we've reflected back isn't actually what they are trying to convey, or maybe we're misinterpreting, right? That kind of puts them back in that driver's seat to course correct. And then our summaries, I just sort of see as a means of being able to link all those reflections together. Sometimes we have, this sort of wealth of information that's been shared and some really rich sharings. We need to package that a little bit tidier every once in a while. So being able to link those reflections together and, sort of say, just to make sure that I've got this right. And then trying to package together what your client has shared over that period of time is a nice way to check in, package what it is that we've been talking about so that we can then maybe move forward to what our next steps are. Now, once you've gotten those principles and the strategy of using our ORs and you're on board with shared decision making, it can be helpful to have a bit of a structure. And my guess is you're already using a lot of these topic areas when you're having a conversation with a client to get a sense for how you might co-develop an exercise program. First, there is getting a sense of where your client's at. So it's important that we meet them with where they're at. So getting a sense for what they're currently doing for physical activity, what are their goals, and why, really importantly, why are those goals important to them? Are you here because you've got, sport aspirations? Is it because maybe you want to be able to live independently, play with your grandkids, right? We all have different reasons for maybe why we're exploring this physical activity space. What are the things you want to do? So physical activity, it's a lifestyle, right? And we're more likely to do the things that we enjoy. So what are the things that we get fired up about, or are we maybe excited to try? What are the things that you have available to you? So not everyone has access to a gym. Not everyone has access to fancy equipment. So getting a sense of what your client has available to them is an important part of that conversation so that we're not overextending and asking for resources that aren't available. And then what are the things that can get in the way? We all have things that get in the way of being physically active. So recognizing those and being able to problem solve those together is a really important piece for that behavioral maintenance. All these pieces, and I'm not saying this is an exhaustive list, but if we can start with this conversation and ask these questions around these topics, this is a really healthy beginning to being able to co-develop an exercise prescription with your client. Now, the last topic here is talking about follow-up. So we have this fantastic plan, and it's great if we get people started and ready to go, but even better if this is a train that we can keep on chugging. So supporting movement as a lifestyle, there are 93 different behavior change techniques. I'm going to tell you just about a couple here today. So one of the best bang for your buck techniques or strategies that we have to help people to start and stick to a behavior, in this case, it's physical activity, is monitoring. So saying something like, the next time you come by, I'll check in to see how you did on your goal, right? And then not only are we monitoring
for ourselves as perhaps exercise professionals, but encouraging that monitoring amongst the clients themselves. So are we using perhaps fitness tracking devices? Maybe it's a paper calendar. That monitoring is a really powerful tool. And if I was going to put my money on one behavior change technique, that's the one I would put it on to help support starting and sustaining physical activity. Now, of course, we might not always, when we follow up, meet our goals, and that's okay. It's important that we're able to make adjustments. We can celebrate the accomplishments, and it doesn't necessarily have to be that we reach the goal. Maybe it's part of the goal, or maybe it's a shift in our attitudes, or maybe we've even just changed some of the things in what we're doing to prepare for physical activity. But inevitably, we have setbacks, and inevitably, we will experience challenges. So how do we then work together to problem solve and make sure that we are not discouraged when we don't meet our goals? And that's all to say that humans are dynamic, and so too should be our goals and the ways in which we work together. So to tie this all together, everyone experiences changes to their ability to participate fully. That's why when we talk about inclusion, yes, we're framing it within the context of working with individuals with physical disability, but this concept is really something that benefits everyone. When it comes to disability inclusive language, everyone has their own preferences. So being open and able to listen and ask questions so that we respect those individual preferences. Universal design learning can be applied to our communication, and the very root of it, let's keep things simple, flexible, give options, and that'll help us to make it accessible. And then by asking good questions, using our attitudes and our philosophy around shared decision-making, we've got those motivational interviewing skills like our compassion, acceptance, partnership, evocation, and our open-ended questions, affirmations, reflections, and summaries. And then using follow-ups as a way to meaningfully engage clients in shared decision-making. Thanks, everyone. That's everything we have for you today, and we hope to see you in our next training.